You're standing at this counter, handed a tiny bottle of pills and told it costs $300. But here's the secret they don't want you to know. That medicine only cost $15 to actually manufacture. Where did the other $285 go? It didn't go to the scientist who discovered the cure, and it didn't go to the pharmacist helping you today. It vanished into a black box, controlled by a shadowy middleman you've likely never heard of. Welcome to the shadow health economy. A system where your sickness is a volume business and the middleman markup is the feature, not the bug. Today, we're pulling back the curtain on why American healthcare costs double every other advanced nation while delivering worse results. We're going to look at the mercenaries of the pharmacy counter and the massive economic engine that is literally designed to keep you paying. Step 1. Meet the puppet masters. To understand this, you have to meet the pharmacy benefit managers, or PBMs. They were originally supposed to make insurance more efficient, but they've become the puppet masters of drug pricing. Think of it like a village market where a market coordinator steps between the baker and the hungry villager. The coordinator tells the baker, "Give me a kickback if you want to sell here," and then tells the villager, "This bread is rare, so it costs 10 times more." In the real world, this is called spread pricing. PBMs charge your insurance company $100 for a generic drug, pay the pharmacy $20 to provide it, and pocket the $80 difference. They even demand rebates from drug companies to put their medicine on a formulary, the list of drugs your insurance will actually cover. If a drug company brings a life-saving product to market with a low price, they actually get punished by the system because there's no cut for the middlemen to take. Step 2. The research wrecking ball. Now, you might think, at least the government is funding the science, right? Well, it's complicated. Between 2010 and 2019, 99% of FDA-approved drugs had ties to research funded by the National Institutes of Health, or NIH. Every dollar the government spends on this research returns an estimated $2.46 to the economy in just 1 year. But right now, that engine is facing a wrecking ball. There are plans to cut the NIH budget by 40%, which has already led to thousands of layoffs and the cancellation of billions in research grants. Scientists are literally considering leaving the United States for Canada or China because the funding for cancer and Alzheimer's research has become so uncertain. We are essentially dismantling the very system that creates the breakthroughs, while the middlemen continue to hike the prices on the results. Step 3. The 10% GDP trap. Why is this so hard to fix? Because our economy is now addicted to the bloat. Nearly 10% of our entire GDP is tied up in medical bureaucracy and spinning the wheels of this broken system. This isn't just about doctors and nurses. It's about the 20 million people employed by a healthcare industry that spends nearly $750 million a year on lobbying alone. If we actually made the system efficient tomorrow, we would shed millions of jobs and potentially trigger an economic hit larger than the 2008 financial crisis. We've built a fortress of wealth where the players are incentivized to keep you on the machine rather than referring you for a transplant, because a healthy person is a lost customer. Step 4. The wellness distraction. And while the system rots, we're being sold a distraction version of health. The wellness industry wants you to buy $14,000 dumbbells and protein water while ignoring the things science says actually matter: fiber, sleep, and community. They sell you body fascism and expensive plastic workout gear because you can't monetize a good night's sleep or a walk with your neighbor. The verdict is simple. Prescription markups and healthcare bloat aren't glitches. They are the result of a system that treats you as a revenue stream rather than a human being. If you want to see the data we use to track these markups, check the links in the description. If you're tired of being a captive audience at the pharmacy counter, hit that subscribe button. We're going to keep digging into these invisible systems until the black box is wide open. I'll see you in the next one.